The NHS came kicking and shouting in lifetime on July 5, 1948. It was the at first period everywhere in the planet how fully complementary health was done accessible on the base of nationality, quite rather than the fee of charges or insurance coverage. It driven hospitals, doctors, medical staff, and dentists along by one facility. But in the 70-year with its create lot has modified. The numbers work for the NHS include boomed. Down there are now human beings involved by the public health facility through the UK, manufacturing it the 5 greatest tenant in the planet. The largest team in the labour are medical staff. The numbers involved include trebled. But how pales in smallness following to doctors. Down there are now 10 times as lot work for the public health facility as down there were while it was created. The partially reflects how rapidly medical has progressive and how consumer demand has enlarged. Importance lot more than care expert are necessary to thoroughness for patients. But roles include modified too much. The job medical staff do present has be lot more than special, it is now a extent level occupation. The main private thoroughness they utilize to ensure is now lot more than potential to be made by health assistants, in medical staff implicated in provided facility thoroughness. How was one day the retain of doctors? Of year, as the quantity of personnel has grown up, so has the budgeting. The sum consumable on public health is now 12 times greater rather than it was while the NHS begun, and how's following you get bloating in expense. Governments above the year include had to put more than of their cash in the public health facility. Present 30p out of each £1 consumable on services goes on public health. It has intended waterfall in some areas of conducting. Amongst the largest losers include bin defense and habitation. The previous year were hard. The budgeting had to be cut in the previous 1950s as the by the government struggled to hold up in consumer demand. It constrained ministers to enter extortion for prescriptions, stomatological job and glasses. Present prescriptions price £1, but just in England, or down there are lot exemptions, cover family, older human beings and such in specific facility. In another place in the UK they include been done complementary once again. The is fair one of the ensuing consequences of degeneration, that has seen person administrations taking into account monitoring above public health politics. Not all has lost up. The largest evidence sample is the quantity of beds. Down there are now 4 persons times less beds rather than down there were initially. The is since lot more than can be made in the society. And patients as well expend lot less than period in clinic rather than they one day did. Female who offer childbirth present now tend to keep on the identical day or the day following. Following the create of the NHS, as childbirth became medicalized, female would expend a 1 week in clinic. It is a such history for operative. The at first hip replace was transferred out in deceased 1948. The patient consumable weeks in clinic. Now the transactions can be made as a day instance. At the cardiac of the history of the NHS, is its effect on the nationality's public health. Human beings now dwell 13 year much longer rather than they did 70 year back. Superior accessing to health has play a key part. But it is as well cost noted how in the 70 year up the create of the NHS, lifetime expectation in fact enlarged by dual which it has with. Accessing to pure water supply and building of sewers were 2 of the largest factors in how baby mortality rate, certain as deaths up the infants at first date of birth, has superior sharply. Down there are 5 key influences: inborn anomalies, untimeliness, flash baby die symptom, parent complications and childbirth injuries. The create of the NHS, importance born excited of household in a care environmental, and the promotion of medical include been extremely powerful. Else element is immunization. The NHS was set up not just to consider disease, but as well to contribute nice public health. The introduce of the poliomyelitis vaccination in the 1950s is a ultimate sample of the program. Cases of poliomyelitis could climb up as top as 8,000 in plague year, but one day human beings begun receive immunized, the numbers omitted rapidly. Down there is now a inclusive vaccination program in infancy. In immunizations cover all of brain fever and parotitis to whoop coughing. Superior health and immunization include intended. The facility human beings are moribund of include modified. Communicable diseases, cardiac attacks and strokes are no much longer pretending the quantity of lives they one day did. Instead of, human beings are more than potential to be residing in length-term facility. For that down there are no cures. The largest noticeable of these is imbecility. Support human beings who can person lot year of impoverished and worsening public health is maybe the largest problem for the following 70 year. Visible journalistic by David Tan.